Have you ever wondered what a pelvic physical therapy appointment might really look like? This is a super common question that we get from all of our clients who come in to see us. Most every person is a little bit worried about what pelvic physical therapy might entail. So today I'm going to explain a little bit about what to expect at your first appointment for pelvic physical therapy. My name is Dr. Brooke Kalisiak. I'm the owner of Legacy Physical Therapy, and I'm a pelvic physical therapist who is passionate about making sure that people receive the appropriate pelvic health information and care. What should you expect at your first pelvic physical therapy appointment? The very first thing is that you should expect to be treated with respect and listened to thoroughly. The first part of any evaluation at our practice is a lot of talking between you and your treating therapist so that we can better learn what's going on with you, what makes your symptoms better, what makes them worse, what have you tried before that's worked or hasn't worked, what are you hoping to gain out of coming to physical therapy, what are your goals that you want to achieve. We want to establish all of that up front so that we can provide you with the most individualized care to help you achieve those goals. The third part of the evaluation is truly where we go and look at the pelvic floor muscles. All of this is done to your comfort level and is typically done by having you undress from the waist down and then laying down on the treatment table covered up with a sheet. And then we'd be inserting one glove finger into the vaginal or anal canal depending on what's going on. Because remember, if I grab my pelvis here, all of this reddish pink is pelvic floor muscles. And so it goes from our pubic bone in the front to our tailbone in the back. And it goes around, for women, our urethra, our vagina, and our anus. So we need to assess all the muscles in this area to see if they're contracting and relaxing appropriately, if there's any knots or trigger points in them. Are they coordinating together with the abdominal muscles and the diaphragm up above? So all of this gives us lots of really good information as to what might be causing your pain and symptoms. And especially looking in and assessing those muscles internally lets us get to these deeper muscles that may be causing some of the problems, like bladder leakage or pelvic pain or pelvic organ prolapse. So the best way to assess them is that single finger insertion into either the vaginal or anal canal. But again, this is done to your comfort level. And for many people, we simply can't do that on the first visit because they're dealing with pain issues. But it's something that we work towards, especially if activities involving vaginal penetration, such as intercourse or use of tampon or a gynecological exam, are something that the patient is trying to achieve as one of their goals. So now that the therapist has spoken with you about your symptoms and your goals for therapy, they've evaluated how you're moving and how your muscles in and around the pelvic area are functioning, they've looked at your pelvic floor muscles, they now step out of the room and let you get dressed, and then when they come back in, they go through all of their findings with them. So we explain what we think is going on that might be causing your symptoms and come up with a plan to achieve your goals. So this might include doing different exercises, practicing different breathing techniques. It might include some hands-on techniques. It may include dry needling, cupping, scar massage. It may include bladder retraining activities or urge suppression techniques. All of this is individualized to what is going on with you and your symptoms. So at our clinic, you leave that appointment knowing exactly what is causing your symptom and with actionable items that you can be working on that day to start it getting better. And you and your therapist come up with that plan to figure out what is going to help you achieve your goals the quickest so that you can get back to doing what you love without worrying about any type of pelvic health symptoms. So there you have it. Those are the stages of a pelvic physical therapy evaluation. I hope this helped to further explain things and set your mind at ease to let you know that pelvic physical therapy is both beneficial and within reach and is not as scary as you might think it is, and honestly can be so beneficial to helping you reach your goals and get back to doing activities without having to worry about pelvic health issues. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.